My name is Dr. Rabinowitz. I'm a board-certified plastic and reconstructive surgeon, as well as board-certified hand and microsurgeon. The treatment for wrist arthritis, of course, depends upon the severity and how the patient is managing day to day with their arthritis. There is a range of procedures that can be done. Certainly, there are times when we can just treat them with an injection of steroid, but that's usually a temporizing measure that the patient will later need more definitive treatment. So the main options for wrist arthritis tend to be either excising the arthritic bone and then doing a limited fusion of the other bones, or at the worst case scenario, it would be a total wrist fusion. There's a whole range of procedures within that, and my goal always is to maximize their motion and maximize their function of their hand, including their strength. Nearly all reconstructive wrist surgical procedures are now same-day surgery. That's the wonderful thing that's evolved over the past 10 years or so. And also there are long-acting anesthetics we can inject into the wrist at the time of surgery to give them significant pain relief for the next 48 hours after surgery. So what they can expect is most of these procedures are done under anesthesia. They're asleep. And the procedures will typically be somewhere between 1.5 and 2 hours for most of them. And they typically will go home about an hour and a half after the surgical procedure. They will have a bandage on, they will have usually a splint on, and most of the time they're able to move their fingers, just not their wrist. Because of the long-acting anesthetic, there really is no pain for the first couple of days, and thereafter, usually only a minimal amount of pain medication is required. Outcomes for wrist surgery depends very specifically on the type of injury and the extent of the injury. Obviously, our goal is to restore motion and to restore strength, and we do that to the best of our abilities. Certain procedures may result in some limitation of movement, but usually it's not enough to impact what they do day to day. And in terms of recovery, depending upon the severity of the injury, the extent of the surgery, typically we're looking anywhere between just a couple of weeks recovery for arthroscopy to 2 to 3 months for the more invasive and complicated wrist reconstructive procedures. Reconstructive wrist surgery is right for the patients when we, meaning the patient myself, after discussion, realize that the injury that they have is a significant factor that impacts their lives. That it either impacts their ability to work or to do whatever activities they like to do in their free time. So that's a decision that I will make with the patient every time. And usually we try to start non-operatively, but if it comes down to surgery, that's something we'll discuss with the patients in terms of what we need to do and what they can expect post-operatively.